Hi, my name is Roland Francis, and I am the Assistant Wastewater Superintendent for Indiana Borough. I assist in overseeing an 8.2 million gallon wastewater treatment plant located in rural western Pennsylvania. Our facility is an activated sludge treatment plant that services approximately 25,000 people, which includes Indiana Borough, White Township, and Indiana University of Pennsylvania. I would like to speak briefly regarding our wastewater surveillance program and encourage others to participate and learn about this important new technology that is changing wastewater treatment plants into facilities that can analyze and assess the health of the community in which it serves.
Early in the pandemic, very little was known about the COVID-19 virus, how it spread, and how we could contain it. I remember hearing about theories that the virus became aerosolized and spread from a restaurant with poor ventilation in Wuhan. This became an immediate concern for worker safety, as we have thousands of pounds of biosolids under aeration every day. We scrambled to purchase adequate numbers of N95 masks for our workers, and they were in short supply. We, like most people, knew very little about COVID, infectious diseases, or pandemics. In March of 2020, through our partners at IUP, we learned about a new startup company, Biobot Analytics, that was offering a pro bono wastewater surveillance program for COVID that was practically free to local governments. Wastewater surveillance has a long history that dates back to the 1850s, when scientists first analyzed sewage samples to study cholera outbreaks. However, modern methods of wastewater surveillance were not developed until the 1990s, when researchers started using molecular techniques to detect poliovirus and illicit drugs in wastewater. Our treatment plant was part of this original group of approximately 100 wastewater plants from around the nation which provided samples to measure the spread of the COVID-19 virus. Since previous research has shown that a high level of viral shedding occurs within the feces of persons infected with COVID-19, a study was conducted by Biobot Analytics, working with researchers from Massachusetts Institute of Technology, Harvard, and Brigham and Women's Hospital. From which, Biobot Analytics developed a unique protocol for identifying the amount of COVID-19 viral RNA in wastewater samples. Using a molecular biology laboratory technique called PCR, or polymerase chain reaction. Combined with community modeling, analyzing and researching the virus in a specific community has uncovered hidden secrets and trends which over time, has enables communities to 1. Unmask the true scale of the outbreak beyond patient testing or hospital reporting, and reveal the asymptomatic carriers who have no symptoms. 2. Guide officials to make smart choices about when and how to intervene to stop the disease from spreading further. 3. Foresee the likely impact on hospital capacity and plan ahead for the resources and actions needed to protect public health. 4. Track the effectiveness of interventions and measure how long it takes for the outbreak to subside, and 5. Stay alert for any signs that the disease may be resurging. For us to enter the program was quite simple. We filled out an application and provided a raw influent sample, in 350 milliliters Falcon tubes, at least twice per week. Biobot supplied everything needed: the bottles, ice packs, the chain of custody which you would fill out online, and pre-authorized shipping boxes to return the samples back to their laboratory. We could drop the sample kit off at any Federal Express location, and it would be overnighted back to their laboratory for analysis. Once the analysis was completed, Biobot would email us a report which detailed the viral concentration in viral copies per liter, and a normalized concentration which adjusted for population and flow, along with trending and comparison information at county, state, and national levels. We shared this information with our partners at IUP and Indiana Regional Medical Center, IRMC, and used it to track how our community was doing in terms of preventing and controlling the spread of COVID-19. We also compared the wastewater data with the clinical testing data that was reported to the Pennsylvania Department of Health. Since the COVID virus is shed in the feces, often before the person has any symptoms, it is a leading indicator. We found that the trends matched very well. The wastewater data was able to predict future changes in COVID-19 cases up to 10 days in advance. This was very useful for us to anticipate and prepare for surges in hospitalizations and allowed us to inform the public on our website and dashboards. This is all done in real time. Being a rural facility, we often read about what was happening in larger cities and elsewhere in the nation, with the spread occurring sometimes weeks behind that of the major cities. Having real-time results available was invaluable. The data about the spread of new variants even enabled our local hospital to know when to use or to stop using certain medications, some of which were only effective against certain variants of the virus. Furthermore, as the pandemic progressed, this testing became even more important, as more people started using home testing kits that were not reported to the state. This made the clinical testing data less reliable. However, the wastewater data still gave us a good picture of the COVID-19 situation in the community. The biggest hurdle we had to overcome was funding. Once BioBot's pro bono program had ended, we needed to find money to continue the testing. At that time, a test ran about $350 per sample. We were very fortunate that our borough council felt that this information was invaluable and continued to fund the program. The good news is that now the federal government agrees and is fully funding most testing programs. The CDC National Wastewater Surveillance System. It is a program launched by the CDC in September 2020 to monitor the presence of COVID. The program also supports genomic sequencing of SARS-CoV-2 in wastewater to detect variants and other pathogens. This program includes more than 400 testing sites worldwide in providing real-time and place data for more than 60 million people in the United States. Wastewater surveillance is not only useful for tracking COVID-19, but also for detecting a wide range of other pathogens. For example, some places have used this technique to monitor poliovirus, monkeypox, rhinovirus, salmonella, antimicrobial resistance, illicit drug consumption, and more. This project demonstrated how a rural community like Indiana can leverage innovative and collaborative solutions to tackle public health challenges. I am proud of our achievements, and I hope this inspires others to pursue this new technology that is revolutionizing public health and the role wastewater treatment plants play for our community.
Thank you for watching my presentation. I hope you found it interesting and informative. If you have any questions, please do not hesitate to contact me by email or phone. Thank you for your time, and I hope you find this new technology and its applications as interesting and beneficial as I did.